How would you feel about a mandatory mental health checkup as part of your yearly medical exam? Yearly medical exam? What are you talking about? Mandatory? No thanks. Highly encouraged? Subsidized? Day off work to go get your mental health checked out. National holiday for mental health checkups. Yes, 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 all that. Mandatory? No thanks. I mean, I'd like to be able to get a yearly medical exam before I start worrying about mental health. If it meant I get some sort of treatment that didn't result in a huge bill later, then cool. It's incredibly hard to do. Except for the really extreme cases. Most mentally ill people are capable of appearing normal. Especially people with depression, anxiety. If they want to. Forced. Yikes. Greater than yearly medical exam. Lol. Phewick that. Nobody is going to mandatory anything on me. I mean, that sounds great in concept, but also the sort of thing that would instantly be turned to be used against every sort of marginalized group that exists within like 14 minutes of being implemented. Orwellian as fuck. And who gets a yearly medical exam? My doctor always does this. To an extent. At my yearly checkups. Always asks where my stress and anxiety levels are. If I'm depressed. Mood swings. Etc. She always tries to give me anti-anxiety meds. Very high stress job. But I always decline. Why mandatory? Optional mental health check or an optional therapy session, sure, but why mandatory checkup when normal health checkups aren't mandatory? It sounds like a government keeping tabs on people more than it sounds like helping people. How would you feel about banning these type of posts? I think making most any health issue mandatory is a dangerous slippery slope. Vaccines I understand in most cases, but not a mental health checkup. Asterisk wait stop. I didn't write that. There's someone else in here who's typing. Someone help. Send a mandatory health specialist ASAP. Asterisk. A good PCP should be keeping an eye out for mental health warning signs anyway. Not great. Mental health is far from a cut and dry, and it would be incredibly easy for a doctor to say, you seem depressed, try some XYZ drug, which they're getting money from reps to push. Most depression drugs have some side effects IRC. I think the doctor asking about how they feel their mental health is would be fine. If the person wants to discuss it more, they should be able to. But it's too fuzzy of a field to have any approach apply to everyone. It's like, have you seen how people would get medical marijuana cards? If there's an incentive to diagnose someone with something, they can do it pretty easily. I don't think we want the doctors acting on any behalf other than the patient's. Can't have a mandatory mental health check if you don't have an annual exam. Fuck off with these shitty "how would you feel" posts. Fuck no. I don't believe in mandatory anything.